All right, we're back. I've been doing this thing and I don't think anybody's been watching. I hope people are here, and if you can see and hear me loud and clear, please send me some hearts so I know that I'm doing something helpful. So, would you use food to get a dog to do what you want? Well, I do. Miss America, Target, girlfriend, there. She has to touch her nose to it. She gets the immediate click. She was so excited about the food that she, anyway. Yeah, food rewards. Lead dogs of a free-living canine social group, they reinforce behaviors they want by allowing access to resources like food. And our pet dogs, our domestic dogs, they can take security from a structure that they innately understand, like working for resources. So, let's do that, shall we? And by the way, if you have a dog or know a dog, oh, thank you, Carolyn. Do you think we're good now? I think we are. All right. So if you know a dog who doesn't follow instructions, put the information in the comment line, would you? Because we can talk about that and maybe help you unravel this mystery. And by the way, in case we haven't met, I'm veterinarian Dr. Jeff Nickel. This is Miss America, the Nickel family border collie. Here's Gaston and Tony. They're enjoying snacks on my writing table here.
Thank you, Elaine, for...
Oh, yes, and Elaine, thank you so much for letting us know that we weren't live. I thought I was, but I didn't have anybody participating. So again, if you can see and hear me, please send me some hearts so that I know people are actually tuned in. We're not doing this alone here. Anyway, I'm residency trained in veterinary behavior medicine, many years of experience in general practice, and we're always looking for problems elsewhere in the body with every behavior case we see with cats and dogs, because those things have a very big influence on behavior disorders in many cases. So the brain, where all behavior comes from, does not operate in a vacuum. Joint pain, stomach or intestinal problems, skin issues, ear problems, dental problems, all of that stuff. Heart problems, if they have trouble breathing, all of that stuff influences neurotransmitters. And yes, thank you very much. We have, Richard, you're here. Carla, wonderful. Thank you for letting me know. I'm sorry about that. I don't know what the heck happened. I just, stopped and deleted the first video that I thought I was doing here and restarted. Okay, well, anyway, I'm glad you're here. So, I wanted to tell you a story. I'm not a dog trainer. Sometimes people confuse behavior medicine with training. It is not. It's the same difference between being a school teacher, a person who does highly essential work, especially if they're really good at it, and a psychiatrist who treats mental illness. And people think mentally ill animals? Well, the brain is the most complex organ in the body. There are so many things that can go wrong, and that's why people like me do a residency in behavior medicine, because it is a specialty unto itself. And my job, my work, is treating pets with behavior disorders. But training, I know something about that, in part because it capitalizes on learning theory, which we use in behavior medicine when we use behavior modification methods. And let me show you a picture of this guy here. Some people have seen him before. And his name was Juan Gomez. He actually had a last name. He was named after an excellent veterinary radiologist that I knew in California. And Juan Gomez was this wonderful dog who was man's best friend. I'll tell you what, he endured great changes and challenges in my life with me. And when he was a baby, in fact, thank you, when he was just a kid, just like Miss America here, I'm sitting on a cat feeder here. Gaston, sorry about that. I was sitting on your food source. I picked him out of a litter. I picked this girl out of a litter too. When you pick a puppy, and by the way, you can go to my YouTube channel, Dr. Jeff Nickel, and you will see that I have a video on puppy selection and one on kitten selection. And there's a lot of little things you can do, but the big thing you want is to choose the puppy in the middle. You don't want the bully who's shoving everybody else around, and you don't want the shrinking violet in the corner. I have a story in just a minute to explain how that can turn out sometimes not so well. So Juan was the assertive guy, pretty somewhere in the middle, and he worked out very well with me. So we took him to puppy obedience class, basic novice it was called. I think he was about 5 or 6 months old at the time. Nowadays we have puppy training classes, and they're really important too, sort of like starting a child in kindergarten. Well, anyway, took Juan to obedience training class, and oh, hello Cindy, I'm glad you're here. I'm delighted. Thank you for coming. By the way, you know what? I've been off for a few weeks. Anybody notice that? My excellent wife and I went on vacation in Northern California. We went to Big Sur, and we went to Bodega Bay, and we went to, where else did we go, Carolyn? Sebastopol. Big Sur. Big Sur. And vineyards all over the place, and beautiful beaches, and we climbed up on the cliffs. It was a wonderful vacation. We were gone for about a week and a half. So now I'm back. Anyway. So we're at obedience class, puppy training class, and it's a nice big room. It was at the Sandia Dog Obedience Club here in Albuquerque. And the size of the room really matters, because when dogs get a little fearful or nervous or anxious, they need to not feel crowded. So it was a good location. And of course there are a bunch of other people there with their dogs. And Juan took to this right away. But one of the other students, a man named Bob, big fella, had this delightful female golden retriever, 6 or 8 months old. Her name was Star. Just a wonderful dog. But she clearly was from the lower end of the hierarchy in her litter, and it wasn't the best match between this big gruff guy, nice man. I got to chat with him a few times, loved his dog, no doubt, and she certainly loved him. But he didn't have a lot of patience. And so when we're teaching these commands, like come and sit and down, she didn't perform immediately. He used this gruff voice, and he was a big guy, and he kind of leaned over her, and he wanted what he wanted, and he wanted it now. And all she did was roll over on her back, wag her tail, and show her tummy. So why does a dog do that? Well, dogs are highly communicative. They're very social. And in a canine social group, with the other dogs and with their person, they communicate, among many, many things, where do they stand in the group. And the high-ranking dogs explain to the others that, hey, I'm the head banana here, got lots of stripes on my sleeve. And the lower status dogs often remind their superiors that they are lower status. So Star would do that, especially when Bob would get kind of gruff and impatient. And he wasn't getting really any results at all. Well, the instructor, a lovely woman named Lindsay, would often take a minute and go over to Bob and say, now Bob, she was a really sweet lady, and she'd say, Bob, now if you slow it down just a little bit here and speak a little more gently, then Star's going to catch on. She's going to do all right, but you're trying to get results a little too fast here. And it was really important and valuable advice, and Bob just couldn't quite get there. And they did not finish the class. He wasn't getting results. And he is, without doubt, with one of these results-oriented people. He wasn't there just for the experience. He wanted this dog to learn this stuff and learn it now. Well, Juan was a much easier student, and his personality and mine were much better matched. And he did very well. In fact, a little good-natured obedience trial at the end of the class. And, of course, he was the top scorer. Well, we went on from there to the advanced novice class, and he loved this stuff, and so did I. And back in my early 30s, when I got one, well, mid-30s, at that point in my life, I was sure that I was not going to have children, and I had not met my wife yet, and it just didn't see it in the cards. But working with Juan and teaching him and bonding with him, and you know, he and I would do everything together. If you look carefully at this picture, you know, you see what's behind him is my backpack. And that's in the wilderness. He and I were serious backpackers, and he carried a lot of our equipment and his own food as well. He was a team player, I'll tell you what. And we ended up campaigning all over the Southwest. And in fact, he was such a high performer that he was nationally ranked one year. And we ended up with a utility title, which is a very high, highly skilled obedience that's required to learn that. And we loved it every bit of the way. People don't have to do that. Very few people do. But obedience is really valuable, in part because of the bond that it creates. it speaks to the dog's innate belief that their job, among other things, is to look to their leader for opportunities to earn resources like food. And there are people who will say, don't use food in training because you're only bribing your dog. Your dog should work for you because she loves you. Oh, your dog loves you. There's no question about that. But we've got to speak the dog's language. They're not going to learn human. We can learn canine leadership. And a big part of that is that the dog will work for resources. That's what they're supposed to do, because they are programmed not really to have any entitlements besides breathing and drinking. Everything else, they've got to show good behavior, and their leaders require that of them, and it works very effectively. It's part of who they are. Anybody have a dog like that, like Star, who just rolls over and kind of loses her mind? If you do, put some details in there, and we'll talk about that. Or any other training or behavior challenges, or physical challenges either. We can talk about any of that. So here's another case. This is a dog named Petal. Not like a pedal on a bicycle. Petal like rose petal. She was 5 years old when I met her. She is a Chiweenie, cross between a Chihuahua and a weenie dog. And that's not a real bottle of Merlot, that's a little stuffed toy next to her. And you can see, if you look carefully on that back foot, do you see that blue bandage? Well, there's a reason for that. This dog always wears a bandage or a sock on that left rear paw. And I explained to her person just the other day that she should for the rest of her life. And the reason is that when she was adopted by her person about 1.5 years ago, she had a severe spinal injury. We don't know how it happened. And she has a very difficult time using her back legs, very little voluntary control. And we have a pretty clear idea that because of the location of the back injury and the fact that she will chew that paw and do severe damage to it if it is not covered, there's probably a tingling going on there that is probably going to last a lifetime. We have her on pain medications, and one in particular called gabapentin that's especially helpful for what we call neuropathic or nerve pain. And she was already in physical therapy when I met her 1.5 years ago. And she had wheels, she had a little wagon. And her person has been dedicated to her from as soon as she adopted her about 1.5 years ago. Here was the problem. When she came into this good lady's home, she tried to bite. If a friend would try to reach because she's so darn cute to pet her, she'd bite people's hands. In fact, she caused penetrating wounds, pretty severe bites. I mean, it's a little 5.5-pound dog. They can do some damage because they can be pretty severely aggressive. And so, of course, her person brought her to me because what are we going to do with this aggression problem? This isn't good. Very sweet lady. She was not going to punish this. She was going to find a good way of helping this dog enjoy a better life. It's one of those people when I say, what are your priorities? What's most important to you about Petal's behavior that you'd like to improve? And her answer, I want her to be happy. She could tell she wasn't. And she wasn't. And here's why. Because this dog not only had what we call pain-related aggression, but she had anticipatory pain-related aggression. In other words, enough people had reached for this dog to handle her, even before her person adopted her, that she would, feel pain when people managed her because of her back. And she often would react aggressively to get people to leave her alone. Now, what kind of a social good life is that? Well, of course it isn't. Got to the point where when people came near, she anticipated that they were going to handle her, anticipated that she would have a stab of pain, and so would ramp up her agitation as soon as people came near and essentially be willing to react very quickly. So what are we going to do with that? Every time her person tried to pick her up, she was wearing gloves. We had to do something better than that. So I explained that this dog had learned from repetition that this was what we call a self-rewarding behavior, because when Petal reacted aggressively and these scary monsters got farther away, she felt better. So it worked, right? So let's not do that anymore. As Dr. Phil would say, how's that working for you, right? Not working at all. Thank you for that heart, by the way. I hope this is helpful. So, and the reason I'm explaining this story is a lot of people don't have a dog with pain-related aggression, but they do have a dog where their current management methods aren't working, and we've got to do something else. And we're not going to punish and reprimand a dog who is afraid of having her pain triggered. This was not an offensive aggressive dog. This was defensive aggressive, okay? Pain-related. So I explained to her person what we're going to do going forward is that we're going to give this dog choices. She can choose to interact with her person, and she can choose to come for food. Would you like that biscuit? It's a choice. So I taught her person to use food to lure Petal toward her so that she would then give an immediate reinforcer for being brave enough to come to her person. And she's done a lot of that. And they go to physical therapy a couple of times a week, and they practice these things at home, and this dog earns food by being relaxed. And she is so much calmer now that she can actually be handled gently. She doesn't startle and flinch when she's handled. But the essential lesson that I imparted to her person, and any dog that bites reactively, you absolutely must remember this rule, commit it to memory. Never allow anyone to approach, reach for, lean over, or stare at a dog like this, because those are perceived as threats. And people will say, hey, I mean no harm, I'm just trying to help this dog, or be friends. Your intentions are important, but that's not the issue. The dog's perception is the issue, and they don't speak a human language. And if they have to react to protect themselves, then let's avoid those fear triggers. And so we never approach. So you say, well, how the heck do you handle them? You squat down on the floor or sit on the floor, turn your side, do not look directly at them, but to the side so you can see them with your peripheral vision, and then use a food lure. And repeat that. And ultimately, the dog can learn to perform obedience commands for food. So the dog's relationship with people has changed dramatically. And when she brought Petal in for her annual recheck exam just a couple of days ago, I was anticipating having to be very, very cautious handling her. I am anyway, because it doesn't do the pets who come in to see me any good if I scare them, right? And so I was just watching her body language while her person was holding her out in the parking lot, because we're still doing that. We're going to change pretty soon, I think. So I said, look, here, do this. Hold Petal, and what I'm going to do is come around next to you, and I'm going to bring out my right arm, and I'd like you to slide her from behind me under my arm. So she very slowly slid Petal in next to me, and I held that little 5.5-pound dog just like this against my chest. And there was no fear, no trembling, no attempts to bite. I just carried her into the hospital. I did a physical exam, drew a blood sample for her annual lab profile, and she did just fine. We were slow and relaxed. We rewarded the behavior that we wanted. But of course, her person had set her up for success by never triggering the dog's fear and reinforcing the dog for being calm and for choosing to interact. The choice element here is real important. Okay? So these obedience classes, start them young. And one of the fundamentals is that, these dogs should, whether it's behavior modification for a disorder or just training basic obedience, these dogs need to earn resources. Okay? So let me show you something else. And by the way, you're welcome to sign up on my website and be a subscriber. It doesn't cost anything. Just go to drjeffnicol.com, drjeff, Nichol. And at the bottom of the homepage, you can subscribe. Just put your email address. And every Tuesday morning, you'll get my media blog and this Facebook Live, so you don't necessarily have to tune in. And you can share that with your friends. And by the way, something we're doing now, in addition to one-on-one consultations in the veterinary hospital, we're also offering group conferences, much lower cost. And right now, the groups are 4 people. And if you go to my website, you'll see right there when you open it up, drjeffnicol.com. You can choose an individual consultation or a group. And there's a calendar in there to give you the dates. We have groups for dog people, groups for cat people, and we can help people with these things as a group. And it's much less expensive. Sometimes people sign up for a group to determine whether they feel that they actually need a consultation, and some of them don't. Some of them have more severe problems than they realize, but we work with them, okay? So here is a statement from the American Veterinary Society of Animal Behavior, the AVSAB. I'm a member of this. It's a professional organization for veterinary behavior specialists, and they have position statements on various issues. And this one, the newest one, is the position statement on humane dog training. All research-based. It's all annotated with references. But let me just read you a few things in here that I think are very well said. Reward-based methods should be used for all canine training. The AVSAB promotes interactions with animals based on compassion, respect, and scientific evidence. And whether we're talking about the brain, behavior, or any other organ system, it has to be evidence-based medicine. There has to be a research basis, robust research, to support our diagnosis and our treatment methods. And I'm not just talking about medication, I'm talking about behavior modification. And we have very strong research to support earned reinforcers, okay? There is no evidence that aversive training is necessary for companion animals or for behavior modification. Training methods should focus on teaching the animal what to do rather than punishing them for unwanted behaviors. Okay? Just one more thing I'd like to share with you here. Reward-based methods promote a strong, positive bond between dog and owner. A couple of researchers, Rooney and Cowan, in a paper published in 2011, found dogs who were trained with aversive methods were less likely to interact with a stranger during relaxed social play. They developed a fear association. Dogs trained using physical punishment were also less likely to interact with their owners during play. So, we have dogs in our life because we love their companionship and we enjoy play and affection, and that gets damaged with any kind of aversive punishment. So we don't do that, okay? So if you're going to take your dog to obedience class, and I really strongly encourage it, it should be a big area. I know that many places are trying to offer training, and more training is better, more opportunities are better. But sometimes, especially in pet supply stores, they've got a pretty small area, like 10 by 12, 10 by 15, and there's that scent of dog food all over the place. There are people and dogs walking past, a lot of commotion, little parakeets and stuff like that, a lot of things that cause these dogs to be pretty highly aroused, and then they're in this small area with these other people and dogs, and it's not conducive to learning. So a dog obedience club like the Sandia Dog Obedience Club here in Albuquerque, which is a nonprofit club, is often the very best way to go, because the trainers, the instructors, are obedience enthusiasts. You can, of course, turn your dog over to a professional trainer. Some trainers actually board the dog and train. But the problem with that, a couple of things. Number one, you don't really know what they're doing. And secondly, the dog can learn to work for those folks, but your dog needs to learn to work for you. And the dog not only needs to learn that stuff, but you need to learn how to be a canine leader and bring out the best. So it's ideally done both person and leader and dog together. So I hope that was helpful. I'm glad you folks showed up, and I apologize for starting this thing 20 minutes late because we didn't know that we were doing it without participants. So let me just encourage everybody to take the time to build a foundation of trust and choice and freedom for your dog. Because our pets, our dogs and cats, just like people, will become obstinate if their leader only wants their needs met. Our pets can learn anytime during a relationship, even if we've made a lot of mistakes, and we do. They can learn anytime that they can trust us not to intimidate them. So thank you so much for sharing this time with me. I'll be back every week after this. Next vacation isn't going to come up for another, well, probably less than a year, but, not real soon. If you have questions, you're very welcome to post them on my Facebook page. Thank you for that, Hart. And I'll try to answer them on my Facebook page. I'll put them in my column in the Albuquerque Journal. You're welcome to subscribe. But if you or your friends have behavior issues and the cost of a full initial one-on-one consultation is more than you feel like you want to bear, go to my website, drjeffnickel.com, and sign up for a group. And I may be able to give you the help you need. I can certainly get you started. So thank you again, Have an excellent evening, and I hope everybody's vaccinated. We are, and that's why we went on vacation.